world's largest gathering on stiff person syndrome is underway. The Stiff Person Syndrome Annual Symposium has reached full capacity with around 200 in-person attendees and 135 more joining virtually from across the globe.
Joining us this morning to tell us more about it, Dr. Duarte Machado, Director of Program Excellence and Recognition at the Chase Family Movement Disorder Center. Doctor, thank you for being with us. For those who don't know about it, what exactly is stiff person syndrome?
Yeah, many people first heard of stiff person syndrome, or SPS, when megastar Celine Dion announced that she has this condition in late 2022. Stiff person syndrome is a rare immune-based neurological disorder that affects 1 to 2 per million people in the United States. It's due to a decrease of a neurochemical called gamma aminobutyric acid, or GABA for short, due to autoantibodies that are generated by the body. The diagnosis is made by checking for these antibodies and by assessing nerve and muscle function through an EMG, and of course by doing a physical exam and assessing a person's symptoms.
And what are some of those common symptoms?
Yeah, common symptoms include a painful muscle spasms and a progressive stiffness of the truncal muscles. Some people may have difficulty with balance and walking. And then there are also non-motor symptoms such as anxiety, constipation, and shortness of breath.
Doctor, what are some of the treatment options at the Ayer Neuroscience Institute in Hartford, here locally?
Yeah, so the treatment options for SPS are divided into 2 categories. Those that treat symptoms and then treat the underlying disease, immune-based treatments. Symptomatic treatments include benzodiazepines like Valium and muscle relaxants like baclofen. We offer the immune-based treatments, intravenous immunoglobulin or IVIG, and then immunosuppressants like rituximab. And here at the Chase Family Movement Disorder Center, we also offer dedicated physical therapy, occupational therapy, and exercise programs.
And is stiff person syndrome something that develops through life, or that you can, I guess, be diagnosed with later in life? For example, with Celine Dion, this has been in recent years that we've learned that she suffers from stiff person syndrome. So is this something she always had and now she's seeing the effects, or she developed it later in life?
Yeah, but certainly there's a wide spectrum of when patients can develop stiff person syndrome. It could develop even at a very young age in pediatric SPS or later in life. And we don't know what triggers the body to develop these autoantibodies to cause the reduction of GABA in the brain. But certainly patients can develop this at any time point. But typically later in life, women more commonly affected than men.
And what does recovery look like for most people? Can people make a full recovery, partial recovery? What does recovery typically look like?
With the right combination of treatments, patients can do well for a long period of time. I mean, we've seen Celine's example of how she has done well enough to sing at the Olympics. With the immune-based treatments, treating the underlying disease, then patients can do well. And there are newer therapies that are being developed for the first time, specific for SPS, which is very exciting.
Very interesting. Dr. Machado, thank you so much for your time.
Thank you.
All right.